On to news from Chennai now. Chennai's doctors are on strike. They have been protesting against the HC's decision to scrap the quota and postgraduate seats for doctors on rural posting. According to present policy, medical professionals can work in public hospitals for a few years before they apply for post-graduation in government hospitals. Doctors who have served in rural areas get a preference for these seats. However, the High Court order does away with this. Shweta gets us this report.
Doctors and medical college students are holding a day-long protest all over Chennai to ensure that the state government doesn't do away with the quota system that has been set aside for the PG students. This means that employees working in the rural areas will be affected by this move, as it would become hard for them to secure PG seats. As of now, 50% of the seats have been reserved for students who are working in the rural areas. Now what we understand is that people would be demotivated to work in the rural areas and they would rather work in other cities and abroad as well. Also, what we understand is that the day-long protest has been held in all the government colleges in Chennai and other parts of Tamil Nadu. They are saying that it should be retained, and the state government, following the High Court order, has decided to scrap this quota system. So all the students and the doctors want this to be retained in Tamil Nadu. In Chennai, Shweta for Mirror.
Because of the struck down of the court order in Tamil Nadu, 50% of the postgraduate seats are going to add in the central scheme in the postgraduate counselling. Because of that, the entire rural doctors will not have any idea to work in the rural area. That will affect the rural health system. So we are in Tamil Nadu. We are all boycotting the patient care without affecting the emergency care, and we are now conducting one day fasting with the agitation.
We have request to government and MC all are request to kindly don't interfere with the state government policy.
Please safeguard as you were already safeguarding. Please protect us. We are standing at your feet. Please save the government doctors. It is not our privilege, it is our right. Please save.
When none of the doctors are interested in going to rural areas, the whole Tamil Nadu health system, which is one of the best in the nation, will collapse. That is for sure. To prevent this from happening, we are fighting for our service quota and to motivate the doctors to work in rural areas.
Recently, the Madras High Court had given a judgment saying that the 50% quota enjoyed by the government service doctors in post-graduation is cancelled or annulled. This has been going on for the last 25 years. And because of this, we had good doctors in the government setups at the rural areas, especially the primary health centers. And the criteria for joining service or getting a PG during the service is you have to work for 2 years in a rural area. So because of that, we had thousands of doctors working in the rural areas. But this one step, that is going to go for a toss.